This chewable tablet contains a combination of vitamins and iron, which are essential for the body. It is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are important for maintaining good health and are essential building blocks for the body. It is important to take this medication as prescribed by your doctor to ensure you are getting the right amount of vitamins and iron. Be sure to follow the recommended daily dosage and take it at the optimal timing suggested by your healthcare provider. Make sure to chew the Optisource 9 mg Iron-200 Mcg-40 Mcg chewable tablet thoroughly and then swallow it, usually once a day as directed. It's best to take this medication on an empty stomach, about 1 hour before or 2 hours after meals. If it upsets your stomach, you can take it with food, but avoid taking it with antacids, dairy products, tea, or coffee within 2 hours before or after this medication. It's important to take this medication regularly at the same time each day to get the most benefit from it. If you have any questions, ask your doctor or pharmacist. Some common side effects of Optisource 9 mg Iron-200 Mcg-40 Mcg chewable tablet include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. Iron in this medication may cause your stools to turn black, which is a harmless effect. It's important to remember that if your doctor has prescribed this medication, they have determined that the benefits outweigh the risks of potential side effects. Most people using this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. If you're in the US, you can report any side effects to the FDA. In Canada, you can report them to Health Canada. It's important to keep Optisource 9 mg Iron-200 Mcg-40 Mcg chewable tablet out of reach of children, as accidental overdose of iron-containing products can be fatal for children under 6 years old. If an overdose does occur, it's important to seek medical help immediately or call a poison control center. This medication is used to treat or prevent low iron levels in the body, and it is commonly used by people with anemia or during pregnancy. The daily dosage of Optisource 9 mg Iron-200 Mcg-40 Mcg chewable tablet will vary depending on the individual's iron levels and the recommendation of their healthcare provider. It is best to take this medication with a full glass of water, and it can be taken with or without food. It is important to take it at the same time each day to maintain a consistent level of iron in the body. Before taking this chewable tablet, it's important to speak with your doctor or pharmacist if you have any allergies to its ingredients or other medications. This product may contain inactive ingredients that could cause allergic reactions or other issues, so it's best to talk to your pharmacist for more details. You should also let your doctor or pharmacist know about your medical history, especially if you have any conditions such as iron overload disorder, alcohol use or abuse, liver problems, or stomach/intestinal problems. If your multivitamin also contains folic acid, be sure to inform your healthcare provider if you have a vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency without treating the anemia. Untreated vitamin B12 deficiency can lead to serious nerve problems, so it's important to consult your doctor or pharmacist for details. It's also important to note that this medication may contain aspartame, so if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, it's essential to consult your healthcare provider about using this drug safely. Before undergoing any surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to tell your doctor before using this medication. Additionally, if you are breastfeeding, it's essential to consult your doctor before using this medication, as it may pass into breast milk. It's important to be aware of potential interactions with other medications. This product may interact with drugs such as chloramphenicol and methyldopa. It can also decrease the absorption of other drugs like bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. Be sure to keep a list of all the products you use and discuss them with your doctor and pharmacist. It's important to separate your doses of these medications as far as possible from your doses of this product, so be sure to ask your doctor or pharmacist about the best dosing schedule for you. If your multivitamin also contains folic acid, be sure to let your doctor or pharmacist know if you take certain anti-seizure drugs. If someone has taken too much of this medication and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can reach their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Make sure to keep all your scheduled medical and lab appointments. It's important to note that this chewable tablet is not a replacement for a balanced diet. It's always best to get your essential vitamins and minerals from nutritious foods. Be sure to maintain a well-balanced diet and follow any dietary recommendations given by your doctor. If you are taking this product on a prescribed schedule and miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up. This medication is commonly used to prevent or treat iron deficiency due to poor diet, certain illnesses, or during pregnancy. It is also used to improve the body's ability to absorb iron. The dosage is based on your medical condition and response to treatment. Take this medication by mouth, usually once daily or as directed by your doctor. Take this medication on an empty stomach, at least 1 hour before or 2 hours after a meal. Avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after this medication because they will decrease its effectiveness. It is important to store Optisource 9 mg Iron-200 Mcg-40 Mcg chewable tablet at room temperature, away from light and moisture. It should not be stored in the bathroom and should be kept out of reach of children and pets. When it comes to disposing of this medication, make sure not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. It is important to properly discard this product and it is expired or no longer needed. If you have any questions about how to dispose of the medication, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.